Mental health and mental illness. I found the article by Dalia to be very informative, thus I support some of his statements and beg to differ with some that I feel does not make sense. In the article, I noticed that the author creates a clear difference and further warns readers why using the terms interchangeably could cause significant harm to people who have mental illnesses. In the article, I like how Dalia describes mental health as a state of mind that allows an individual to responsibly contribute to society and the community. I agree with the author that such a state is essential for interpersonal relationships, family, and personal well-being. This statement is true since mental health is essential for a person to remain relevant in society. To improve one's mental, one can take a walk in nature, meet with friends and family, or participate in hobbies. To avoid confusion, understanding the difference between mental health and mental illness in the health sector may discourage the stigmatization of mental well-being issues. I concur with the statement that mental illnesses are conditions characterized by alteration of all the factors that lead to mental health, such as thought, moods, distressful behavior that impairs normal brain function. This is valid since the consequences of mental disorders are but are not limited to pain, disability, or death. I support the assertion by Dalia when that mental illness is an umbrella term for all diagnosable mental conditions such as depression, anxiety, and bipolar disorder, among others. I believe patients with the latter conditions can find this helpful since it addresses their predicaments and gives them a solution. I like the article because it provided information that I was not privy to before reading it. Like many other people, I thought that mental health and mental illness had the same meaning. I agree with the author that treating mental health and mental illness synonymously predisposes people living with mental illness to severe consequences, which may further be detrimental to their overall health. I concur with Dalia because she focuses on how patients with mental issues can improve their mental health by walking in nature or interacting with friends. Another aspect that I like about the article is that it highlights how a simple nature walk cannot control or cure a mental illness disorder such as general anxiety. In some cases, I found out that individuals confuse what they read or are advised and mess up at some point if not well versed. Some time back, I visited a healthcare center, and I was surprised at how practitioners misused the two terms. The physical body requires proper nutrition and exercise to remain strong and healthy. The mind also needs to be healthy. Personally, to ensure my mind is always strong and healthy, I look after my body by exercising regularly, eating healthy, primarily vegetables, having 8 hours of sleep, and drinking enough water daily. I can discuss my issues with a few friends and family to avoid being mentally overwhelmed with problems. Dalia distinguishes the difference between mental illness and mental health. The author ensures that the two terms are not confused at all. A person can learn a lot from the article, more so from those in the health field. Patients with mental disorders are likely to get better treatment after a person reads this article. Reading Dalia's article was very interesting and much informative. I was able to understand the difference between mental health and mental illness. I also learned that using the two terms interchangeably may prevent people living with mental illness from receiving the care they need.